Hello everyone, welcome to our channel Anything Medicine. So today in this video we would like to tell you about the surgical types of pain. Actually, whenever we mention pain in surgery, we may mean just one of these three types. First type is shifting pain. A classical example for this type is appendicitis. Well, the second type is radiating pain, which we can observe in a patient with angina pectoris or ischemic heart disease. Third type is referred pain, which we can see in a patient with acute cholecystitis or even pancreatitis or ruptured spleen. Now let's clarify each of these types of pain as it's important for the diagnosis of the diseases. First type is shifting pain, where the patient comes to you complaining about the initial pain in the periumbilical area, which is diffusely unlocalized pain, and we call it also visceral pain, that shifted after 2-3 hours to the right iliac fossa. Now, let's clarify how this happened exactly. Now, in the first phase, we have just inflammation of appendix. And we know that appendix is supplied by the superior mesenteric artery, superior mesenteric ganglion, which in turn supply the T10 segment of spinal cord, as you can see here in the picture. Now you can see also that T10 segment of spinal cord supplies the skin around the navel. And that's why the patient in initial phase complain about the pain, which is visceral pain around the periumbilicus. Now when this inflammation progresses, we are gonna have the second phase. And when this inflammation progresses more and more, the inflammation irritates the surrounding structure of the appendix. And one of these important surrounding structure is peritoneum, which is supplied by the somatic nerves, and we know that somatic nerves give the localized sharp pain. And that's why in the second phase, after 2 or 3 hours, the patient gonna have the pain in the right iliac fossa, which is localizedly sharp. And that's why the pain initially started in the periumbilical area and shifted toward the right iliac fossa after 2 or 3 hours when the inflammation already progressed and irritated the peritoneum. Now, next type of pain is referred pain, which is usually seen in patients with cholecystitis. In this type of pain, patient feels a pain in two different sides of the body which are unassociated to each other or even distant from each other. For example, in acute cholecystitis, patient comes to you with right upper quadrant pain, which is associated with ipsilateral side shoulder pain. Now let's see why this happened. By inflammation of gallbladder, the gallbladder irritates the surrounding structure, including the phrenic nerve. And we know that phrenic nerve has the root C3 till C5 of spinal cord. And this root by the turn supplies the skin of shoulder on the same side. And that's why patient complain of right side of upper quadrant pain, which is associated with shoulder pain due to irritation of phrenic, and in turn phrenic supplies the C3 C5, which in turn also supply the skin of shoulder. And last type is radiating pain, which is observed in a patient with angina pectoris or ischemic heart disease. In this type of pain, patient feels a pain in the original site of the pathology, which is radiating to the surrounding areas which are supplied by the same nerve. As you can see here in the picture, patients with ischemic heart disease have radiation toward the shoulder or even the neck. Keep it in mind since it's important for the diagnosis of the diseases and important to write it in the prescription.